Welcome back to this edition of San Diego People. I'm Carlos Amezcua. San Diego is a biotech hub, as you know. It is consistently ranked among the top 3 cities in the country for life science and biotech research. So it's no surprise some local companies are working on groundbreaking treatments and therapies for cancer. Joining me now is Allan Camaisa. He's the CEO of Calidi Biotherapuetics. Nice to have you here.
Thank you.
So you're also involved in what's called immunotherapy cancer treatment, and you've been working on some processes that attack these cancers with a specific kind of treatment. Can you kind of lay the groundwork for me here?
Yes, Carlos, you're right. The specific area of immunotherapy is an oncolytic virus, and the oncolytic virus goes in. We inject intratumoral, and the key of the oncolytic virus is that it kind of stimulates the immune system to go to work, at the same time destroying tumor cells. So that's a new paradigm because there's not enough to debulk that tumor, and so that virus goes in there. What we do differently, though, is we have a cell delivery mechanism. And why cell?
Like a stem cell?
Yeah, your own stem cell.
Your own so you inject your own stem cells with this virus.
Right. Now we're going to use what we call allogeneic, which is a third-party stem cell, so we don't have to keep harvesting from every cancer patient and combining it with the virus into the
And does that make it stronger?
What it does is what we call potentiation. It gives enough viral load to do its job in the tumor microenvironment, because if you put a virus directly into the tumor, it gets extinguished by the blood fairly quickly. Your blood has a very innate properties to combat the virus.
So it shuts it down before it even does its job.
That's right. And the cool thing about the potentiation is that we help grow it, incubate it before going into the tumor, and then once in the tumor, with a cell delivery, the virus continues to grow inside the tumor microenvironment. So.
Okay, so this is for tumors that you can spot, that you've seen, that the doctors have identified, and so it's targeted therapy, right? And
Absolutely.
Is that introduced with an injection, or how is it introduced?
It's a good question. It's what we do is we do an MRI scan. The doctor looks at the tumor, and then the day of the injection, it's a CT laser-guided injection, so it's very precise.
Okay.
So we know exactly, it's usually 2 centimeters minimum width that we need to inject to make it to be effective. So it's very precise the way we have imaging today, and all the radiologists, what they have at their disposal.
That is remarkable. I just can't even imagine how that whole process works. So that targeted injection, if you will, is it a physical injection, or is it a laser injection? What kind of injection is that? You know what I'm asking?
It's a physical injection.
It's a physical
injection. Needle, and we'll use a quadrifuse needle,
a
needle that has the ability to inject in multiple points. Actually, the needle itself,
while it's moving around inside the body.
Yeah, it actually has its spokes goes out, and then you can actually go into it, and you have multiple areas that you can inject into. But it's very precise.
So once this process hits the cancer cell, what happens to the cancer cell?
Well, you have what we call oncolysis setting in, so the destruction of the tumor cells, and then what we do is these antigen-presenting cells, as a byproduct of the debris from oncolysis, goes to distant tumor sites and educates T cells to go prevent recurrence of cancer, and also hit distant tumor sites that we didn't inject. So we don't always have to inject the actual tumor, just the main tumor, and then you have...
Then your own system does the work.
Well, there's a scalpel effect. You actually have the ability to go to other tumor sites. The technology allows it to kill other cancers and tumors, cancerous tumors in other sites.
Now, Allan, why did you get into this? You're a businessman. You've done a lot of entrepreneuring in your life, I take it. This company is interesting. It's out there with so many trying to combat the scourge of cancer in the world. Why are you involved in this particularly?
Well, I particularly met Dr. Solai, who is the founder, a 78-year-old German scientist who came here, taught at Caltech, world-renowned in his regard, and my dad had prostate cancer in 2014, I think, and everybody has a story that they're always looking for something out there that might be groundbreaking. He didn't have this technology at the time, but I went in and became well known to what he's doing. I got to know him, and then he came to me with a great idea to start a new company, and I was his first backer, and it was more of a passion play. And I sensed that his technology was solid, that he had deep science, and I was proven right that we have really strong patents and really good clinical results due through his science.
You're right. We all do carry these stories with us, and with hopes that some action that we do can change. I know going through that with, as I mentioned earlier in the program, my father-in-law having had cancer, it seemed that we were learning so much more about cancer and its effects and its treatments than I had ever learned before. And quite often patients and families of cancer patients, and even if you have cancer yourself, you do learn an awful lot. And so that must have been the experience that propelled you forward.
Absolutely. You know, when you're passionate, it's easy to pick things up. And you know, I've spent thousands of hours now learning a field. But you know, we have great scientists, we have good doctors, we have a good team, and it's all now at the stage of collaboration and teamwork, and reaching consensus and making solid decisions. Get right advisors online. We have no problem. Not invented here syndrome. We ask for resources out there. We get good medical directors we tap into. We're, you know, John Wayne Cancer Center, Moffitt Cancer Center, NIH, National Institute of Health. We're doing research with them.
And how soon before this all comes to market and you see it every day with every doctor?
You know, we still have to do our phase 1b/2a trial, and then we're talking to the Pancreatic Cancer Network, and it's very promising. And that's the first adaptive trial in the world that I know of that goes phase 1 through 3, at least with the U.S. FDA is what correction on that. We feel that it may be in a couple of years. I mean, depending on this adaptive trial that we're getting involved with the Pancreatic Cancer Network. So we're talking to them right now. So there's a lot of interest by oncologists that are really treating cancer patients that hear about us, and they want to know more. So it's a good sign that we're on
the right path. Yeah. All right, Calidi Therapeutics. Allan Camaisa, thanks so much. Appreciate all the good work you're doing out there to help our cancer patients.
Thanks, Carlos.
Thanks so much for being here this morning on this edition of San Diego People.